If you give someone a bolus injection of propofol, they'll go to sleep and they'll wake up a few minutes later because the dose will have worn off. But by wearing off, what we mean is the drug has redistributed from the active site, the effect site, which is the GABA receptors in the brain. It has redistributed throughout the body, particularly into fatty tissue, because propofol is very lipophilic. It likes to dissolve in fat. And it's this redistribution into other parts of the body that is responsible for its effect wearing off. It's not because the propofol has left the body, it is simply redistributed, and the concentration at the effect site is now low enough that it's not having a clinical impact, and the patient wakes up. This is why if you continue running an infusion of propofol for a long time and then you switch it off, the patient takes much longer to wake up, because during the infusion they have filled up all the fatty tissues in their body with propofol. So it's gone to the GABA receptors, had its effect, redistributed into the fat, but then more propofol in the infusion has replaced it, so you have a continued effect. But you fill up the fat stores in the body, and then when you switch the infusion off, the concentration in the blood drops, but all of that propofol that's distributed into the fat then moves back into the blood because the concentration gradient has flipped. So there's now more in the fat than the blood, so it moves back into the blood, goes back to the brain, back to the receptor, and so it continues to have an anesthetic effect. We call this context-sensitive half-life, which means the length of action or the duration of action of the drug depends on how long you've been giving the infusion for. Something like remifentanil, it will wear off in a couple of minutes regardless how long you've been giving it, because it doesn't distribute into fat. It has a much smaller distribution throughout the body. Whereas propofol and fentanyl are very fat soluble, they distribute widely throughout the body, and they have a much longer context sensitive half time. The longer you've been giving the drug, the longer it takes to wear off.